Tossing and turning at night due to sleep apnea? Well, let's find a solution, custom fit with you in mind. Here's Tony with details.
Sleep matters, and if you're one who struggles with getting a full night's rest, our next guest has a solution just for you. Joining me now with more details is Dr. Randal from Sleep Matters LLC. Welcome, doctor. How are you?
I'm great. Thanks for having me.
I'm happy to have you here. So let's just dive right into it. There are many reasons that can lead up to someone not getting that full night of rest, right? But one that can kind of go unnoticed and also untreated is sleep apnea. So tell us today, what are some of those signs, some of those symptoms that can indicate that someone has sleep apnea?
Well, thanks for asking me that. There are a lot of signs and symptoms out there that people may not realize could indicate that they have, some sort of sleep breathing condition like sleep apnea. And some of those risks include loud snoring, being overweight, having some medical conditions like diabetes or hypertension, experiencing some daytime fatigue. You wake up after a full night's sleep and you just feel like you didn't rest really well.
Yeah.
Getting up multiple times a night to use the restroom. A lot of these can be indications that you have a more serious condition.
So what happens if someone who has sleep apnea but it's not getting treated?
So untreated sleep apnea is a very serious medical condition, and on average it's been shown to take about 10 years off the average lifespan.
Wow.
It can lead to some significant medical consequences like a stroke, a heart attack, can lead to congestive heart failure, and cause things like obesity, hypertension, and lead to diabetes, amongst other things.
Oh my goodness.
People really need to take their sleep seriously.
Yeah, get help ASAP. So when it comes to getting help, what treatment does Sleep Matter offer? And of course, is there a cure for sleep apnea?
Great question. So basically, no, there's no cure for sleep apnea. Sometimes for some people, if you lose enough weight, then that can get rid of the sleep apnea, but most of the time, this is going to be a lifetime condition.
Okay.
The traditional treatment that most people are probably familiar with is going to be CPAP therapy. And that involves, putting the mask on your face and you kind of look like Darth Vader. And, the problem is it works great, but so many people just can't tolerate it. And I hear it all the time in my practice. People come in and they really want to treat their sleep and they're like, I just can't wear the CPAP.
Yeah.
And so that's where we come in, because we do have a great alternative in oral appliance therapy.
So you actually brought a couple of examples with you. Right here is the CPAP, and I can totally understand why someone may feel uncomfortable putting that on their face, but you have another solution too. Tell us about that.
So these devices, it's called an oral appliance or a mandibular advancement device. And it's basically just like wearing a set of custom retainers, just like if someone ever wore some for braces, or some people have worn like a sports guard for playing sports. But they're custom made, and the magic of this device is the way it repositions your jaw in a very specific way to allow that airway to become stable while you sleep. And they are very easy to get used to. People are able to wear these every night, all night. They're easy to maintain, easy to travel with, and people can really use it all night.
Can I hold them?
Oh, sure.
So it is. It really is just like a retainer. You slip them in and the morning, you just take them right out.
That's right.
All right. So I can imagine something like this probably cost a pretty penny. So does the medical insurance cover?
That's probably one of the biggest questions we get is, will my medical insurance cover this device? And the answer is yes. So we are a Medicare provider, and we accept most of the major insurance policies.
Good.
And depending on, of course, the deductibles and the different fine print of your insurance, but for most of our patients, it's either no out of pocket or very little.
That's really good to know. Now, when someone gives you a call, what can they expect when they come visit you all at Sleep Matters?
Great. So when they give us a call, they'll probably get my sleep care coordinator, and her name is India. Just like the country. You're not calling India, that's just her name. And it's very simple. She'll ask a few simple questions, get to know you a little bit, so that we can figure out how to help you. But it usually starts with a consultation, a quick dental exam to make sure that your teeth and gums are healthy enough to wear a retainer. and then we get you into treatment after that.
All right, now speaking of consultation, I hear that you have a pretty cool offer out there. Tell us about it.
Yeah, so anybody seeing this today can give the office a call and just mention you saw this on Great Day KC, and you'll receive a complimentary consultation and even $100 off your treatment.
Nice. Dr. Silver, thank you so much for joining us this morning. I'm pretty sure this is going to be a solution for a lot of people to make sure they get that full night of rest.
Well, I'm certainly hoping that we can help some of your viewers and at the very least create some awareness about this serious medical condition that's out there.
Absolutely, for sure. Well, everyone, give Sleep Matters a call today, and don't forget they're offering a free complimentary consultation and $100 off of treatment. To learn more, you can visit the website or call the number listed on your screen.